should healthcare workers bear the full weight of patient safety, or is there a broader system at play? This question has sparked countless debates, but none quite as intense as the case of Gwen Hendricks. Picture a nurse, dedicated, diligent, trusted. Now imagine that same nurse, but under a cloud of suspicion, accused of the unthinkable. In the heart of Texas, in the early part of the 21st century, a dark narrative began to unfold, a narrative that would challenge our perceptions of trust, responsibility, and the very fabric of our healthcare system. Gwen Hendricks, a nurse by profession, found herself at the epicenter of this maelstrom. The charges: murder, her alleged weapon, lethal doses of medication. Who was truly responsible? The individual administering the doses, or the system that allowed it to happen? The boundaries of responsibility blurred, the lines of trust were broken. In the early 2000s, a Texas nurse named Gwen Hendricks found herself at the center of this very question. Born and raised in Texas, Gwen Hendricks was a nurse with a seemingly normal career. She was a small-town girl who found her calling in nursing, dedicating her life to the care of others. She progressed through her career with a reputation for diligence and compassion, earning the trust of her patients and colleagues alike. Hendricks was the picture of a dedicated healthcare professional, always ready with a comforting word or a kind gesture. Her rapport with patients was remarkable, often going above and beyond to ensure their comfort and well-being. Her colleagues admired her, patients appreciated her, and she was seen as a pillar of her healthcare community. But as we'll soon discover, this image of a caring and dedicated nurse was about to be shattered. Beneath this facade of normality, a sinister narrative was about to unfold. Rumors began to circulate. Patients under Hendricks' care were dying at an alarming rate. The Texas nurse was accused of a horrifying act, injecting her patients with lethal doses of medication. The healthcare community was stunned. How could one of their own, a caregiver whose role was to nurture and heal, be capable of such a thing? The allegations were chilling. Hendricks, it was claimed, had not just betrayed her professional duties, but committed the ultimate transgression. The shock and disbelief were palpable. Colleagues, patients, and their families grappled with the horror of the accusations. The very idea was unthinkable, yet the deaths were real. Each one a tragic loss, a life cut short. The questions mounted. Was it a simple case of medical negligence or something far more sinister? As the death toll rose, so did the pressure on the authorities. The healthcare community was left reeling as Hendricks was arrested and charged with murder. The courtroom became a battleground of medical expertise and legal maneuvering. Gwen Hendricks, the Texas nurse accused of the unthinkable, stood trial for her alleged crimes. The charges were grave, yet proving them became an uphill task. The prosecution argued with passion, presenting circumstantial evidence and drawing a pattern in the sudden deaths of Hendricks's patients. Yet the defense countered with equal fervor, highlighting the absence of direct evidence. They stressed on the lack of concrete proof connecting Hendricks to the lethal doses of medication found in her patients. It was a case built on inference and implication, but the law demanded certainty. After a grueling legal battle, the scales tipped in Hendricks' favor. The jury, bound by the principles of beyond reasonable doubt, acquitted her. But this was far from a triumphant victory. Despite the acquittal, Hendricks' professional conduct remained under intense scrutiny. The Gwen Hendricks case opened a Pandora's box of questions about patient safety. The allegations against her were chilling, and they forced us to confront a terrifying possibility: that those we entrust with our lives could betray us in the most devastating way. The case ignited discussions on the detection of criminal activities within healthcare settings, a sector where trust is a fundamental pillar. It highlighted the difficulty of proving guilt in such circumstances, where the line between medical error and deliberate harm can blur. The burden of proof is heavy, and in Hendricks' case, it wasn't enough to secure a conviction. This case has left a lasting legacy. It underscored the importance of vigilance and stringent checks in healthcare practices. It reminded us that accountability is crucial in ensuring patient safety. While the case remains a dark chapter in healthcare history, it serves as a stark reminder of the importance of vigilance and accountability in patient safety.